The center of it all, TB in adolescents living with HIV, where medicine and sociology meet. Considerations from South Africa. Adolescence is a transition from childhood to adulthood that is associated with specific challenges and vulnerability. This vulnerability is enhanced in adolescents living with HIV as they try to cope with the clinical and psychological impact of living with HIV. Adolescents in South Africa are disproportionately affected by HIV, with lower achievement of the 95-95-95 HIV cascade. South African adolescents living with HIV account for 20% of all adolescents living with HIV globally, with young women disproportionately affected. In this transitional life period, adolescents already experience developmental pressures and structural barriers that result in lower rates of adherence to ART compared to other age groups. All this stems from the concepts. The poor treatment coverage of ART places adolescents at even greater risk for TB, as unsuppressed HIV viral loads is an independent risk factor for developing TB disease. High HIV viral loads are associated with not testing for HIV, allowing disease progression. Testing. Using South African census data, Jooste et al. Found that only 58.8% of 15 to 24-year-olds had ever tested for HIV. This study found that having accurate knowledge of HIV transmission was associated with having an HIV test. In the same line of thought, attainment of secondary education was significantly associated with HIV testing in comparison to not having any education or a primary level of education, underlying the importance of supporting adolescents to stay in school. In the article titled "The Voices, Values and Preferences of Adolescents of HIV Testing and Counseling," Alice Armstrong and colleagues found that adolescents identified healthcare workers, peers, and partners as key influences in promoting or encouraging adolescents to have an HIV test, demonstrating their vulnerability to influence. HIV adherence. In a large cohort of adolescents living with HIV in the Eastern Cape of South Africa, only 23.3% were recorded as virally suppressed in the past 12 months. Adolescents living with HIV from the same population in a slightly different cohort reported only 66% ART adherence in the past week. 3 factors were identified or associated with improved adherence: no physical and emotional violence, healthcare confidentiality, and shorter travel times. Improvement in all 3 combined increased the probability of ART adherence by 81%. In a Cape Town study of adolescents living with HIV, barriers to adherence were strained teacher-learner relationships, negative household dynamics, and ill treatment from non-biological caregivers. Having a strong social support system and having life goals and ambitions were motivators to remain adherent. I mention these factors as they are important barriers that puts adolescents at further risk of developing TB. TB in South Africa, importance of adolescents to TB control. South Africa has the largest HIV epidemic in the world, as well as the highest rates of TB per capita. It is impossible to view the TB and HIV epidemics in isolation, as HIV has driven the TB epidemic in South Africa. HIV infection is the most significant risk factor in progressing from TB infection to TB disease, which makes the 7.7 million people living with HIV in South Africa very, very vulnerable to TB disease and likely to contribute to TB transmission. HIV and TB epidemics are closely linked medically, socially, and structurally. TB is not as easy to diagnose as HIV and often requires repeat healthcare visits and testing before a decision to start treatment can be made. These repeated encounters to access healthcare are barriers to TB care, as patients have to overcome their social and economical obstacles every time they make contact with a healthcare facility. This is demonstrated by a large HIV and TB linkage to care study among people living with HIV in South Africa and Uganda, where only 34% of people with symptomatic TB underwent diagnostic testing. In contrast, there was a 92% success of HIV linkage to care. Addressing adolescent TB is a critical step towards eliminating TB in South Africa. However, adolescent TB is a complex public health care challenge that needs to be understood in the context of adolescence as a unique socio-emotional, neurocognitive, and physical life stage. Understanding adolescent TB, not only medically, but also socially and psychologically, is critical to designing individual, facility, and system-wide solutions. TB is a social problem. The key structural and social determinants of TB epidemiology globally are evident throughout the social economic landscape of South Africa, and this reflects the distribution of TB in the country. An ecological spatial study of TB prevalence in the Eastern Cape province of South Africa echoes the findings across the world that the prevalence of poverty, population density, and average household size are strongly related to TB disease and outcome. Lessons learned from our recent dissertation. There is value in sociological theories and their application in understanding and finding solutions to TB care in adolescents living with HIV. Social factors identified from research, while incredibly helpful, does not explain the why these certain factors are most important and affect adolescents living with HIV. Sociological theories provide a viewpoint and framework to explore further, giving you the lens and grounding to answer the why. Only through this understanding can we learn and adapt and improve systems and support individuals and communities with targeted interventions. Adolescents are the center of it all, influenced so deeply by the world around them, from their households, schools, parents, siblings, and communities, both the tangibles and intangibles. This influences their life course and in turn determines and shapes the ability to access TB care and healthcare in general. Thank you.